So you're big on sedation dentistry. I mean, what procedures do people get sedation?
Everything, Randy. We have a lot of patients that if they've had a bad dental experience, they know that we're the office to come to. We do it for dental cleanings, simple things like that. We do it for anything, implants, bridge work, fillings. There really isn't any kind of specific things that we do it for. Sometimes people who are having surgery definitely want it. We do it more in those situations, but pretty much any procedure, we do it for cleanings just to get people comfortable again in the dental practice.
Okay, now you say there's two main categories of people that come in for sedation.
Yeah, two main categories of people coming for sedation. A lot of patients have had bad experiences in the dental office. We can literally change the way they feel about dentistry.
So like a dental phobic.
Absolutely.
Does that exist? Are there a lot of people afraid of the dentist?
70% of people are afraid or uncomfortable at the dentist. So they come in, it's very, very common. We see them every day. So we get them in, and the big benefit is that we can get them in and do everything in one visit that maybe took us 4 or 5 visits before because they're comfortable. And so we can get a lot of procedures done in a short amount of time if you're under IV sedation. They're comfortable, they don't know what's going on, and they don't have a sore jaw anymore because they were relaxed the entire time through the procedure.
So when you say you can do like 6 months worth of dentistry in one visit because of sedation, it just allows you to have the patient there longer to do a bunch of stuff.
It takes us less time, Randy. We have to have them open for less time because we're faster. When we don't have a patient that's stressing out or anything like that, they're literally napping, we as dentists get to work faster. So we get to do a better job, really focus on what we're doing instead of, are you comfortable? I tell my patients, I guarantee you're gonna have a good dental experience if you're under IV sedation. So
is that right?
Yeah, so I have a lot of patients, not just those two categories, I have a lot of patients who aren't afraid of the dentist, but they're busy people. They have busy lives, and they just want to get it all done, and they want to do it comfortably, so they take the IV sedation option, and they always would say they recommend it to all their friends. It changes the way they feel about getting dental work done. It makes it easy. It makes it attainable.
I mean, even nitrous gas, right? You use that too?
Yeah, we use nitrous. We do oral sedation. We do the whole gamut of sedations. Nice thing about nitrous is that you can drive. You can basically when it's off, you can get in your car and drive away. It's not really an option if you have IV sedation or you have oral sedation with the pills. But they're all great options, and we kind of tailor it to each patient's specific needs. But my rule is nobody gets to have an uncomfortable experience in our dental office.
Nice.
So if people come in, they want to play tough guy, and I know, because I've learned this skill over the years, that this patient's, I can tell their heart rate is going to be up there and be a little stressed. You're not allowed to have a bad dental experience in our practice. And we have become very good at deciding which patients would do better with which kind of sedation, and we offer all three.